name's Carla. I'm a nurse here.
I'm Samantha. I'm also a nurse here at the clinic.
My name's Amelia.
Nice to meet you, Amelia. How are you doing today?
I'm doing alright.
Are you a Dal student?
Yeah, I am.
What do you study?
I came here to study marine biology.
Oh, lovely.
Where are you from?
I'm from Ontario. That's why I came here, because I don't have a doctor here.
Is there something specific that brought you into the clinic today?
Yeah, the other day I had some blisters going on, so I came to get a STI test.
Yeah, we see from your records that you came in a few days ago requesting an STI swab, and your test results did indicate that you're positive for the herpes simplex virus. How do you feel about that diagnosis?
Well, I knew something was going on. That's why I got tested. Honestly, I'm just relieved it's not something more severe. I was prepared for the worst.
Herpes is actually a really common thing. About 1 in 5 or 6 adults have it, and a lot of people don't know.
Wow, really?
Yep, many people are infected with the herpes virus, but don't know it because they may not exhibit any symptoms, or the symptoms that they do have are so minimal that they don't realize they are experiencing an STI. So it's great that you were able to recognize that you needed to come in and be tested.
Well, that makes me feel better. But now I'm definitely going to be more careful. I don't want to get anything worse for this virus to anyone else. I don't know much about herpes, but I know about cold sores, so it's kind of the same thing, right? A lot of people get cold sores.
Yeah, they are related. So both genital herpes and oral herpes are caused by the herpes simplex virus. Oral herpes is usually causing symptoms that develop in the oral cavity of the infected person, and this can include cold sores. On the other hand, genital herpes, which would be the strain of herpes causing your symptoms, affects the epithelial cells or the tissue cells in the genitals.
Alright, so they're like brother and sister viruses? They just cause symptoms in different places?
Typically, symptoms that they cause are usually based on where in your body the virus likes to hide. Oral herpes hides in the nerves closer to the ear, while genital herpes hides in the nerve cells in the lower spine, causing tingling, burning, and blistering in the genitals.
But sometimes they can cause herpes in other areas. So even if you have a cold sore, you should not perform oral sex, as it can cause genital herpes.
Wow, I had no idea cold sores could cause herpes with oral sex.
Yeah, so just like how it's important to refrain from sex when you have an active infection of genital herpes, you should refrain from oral sex when you have a cold sore.
So it looks like I have a lot to learn about herpes then.
That's what we're here for.
First, let's talk a little bit more about how herpes infects the cells in your body, why you only have active infections sometimes, and how antiviral medications help to treat outbreaks.
I've taken a few microbiology classes, so I know a bit about how cells works. But when I got my prescription from the doctor, he didn't really explain anything to me.
Okay, so using antiviral medications such as acyclovir during a herpes outbreak will cause your symptoms to be shorter and less severe. These medications work by preventing the virus from creating the bonds that the virus needs to replicate its own DNA. So basically, antiviral medications stop the virus from being able to reproduce and spread to other cells in your body.
So I should always get antiviral medications when I'm having an outbreak?
Yes, you should.
Is there any way to know when an outbreak is coming?
You may feel some tingling or burning a few days before blisters start to appear.
So if I feel this burning or tingling, I should start using my antiviral medications?
Yes, and the earlier you start using your antiviral medications, the better. What kind of prescription did you get from your doctor?
He gave me acyclovir, 400 milligrams, 3 times a day.
Perfect, that's the recommended dose. And if you find that you're experiencing outbreaks frequently, you can also use a supplemental therapy of acyclovir twice a day.
Alright, so are there any side effects that I could get from these medications?
Acyclovir is generally well tolerated, and the most common symptoms that you are likely to experience, if at all, while taking the medication is nausea, headaches, and vomiting. In rare cases, taking acyclovir can cause acute kidney failure, but typically this occurs within the first 12 to 48 hours after you start taking the medication. So if you do notice any evidence of fluid retention, like swelling in your legs, feet, or ankles, or if you notice a reduction in urine output, you should definitely let your physician know.
Alright, and how much do these pills cost? I have health insurance through Dal. Will my plan cover the cost of the pills?
So the 800 and 400 milligram tablets of acyclovir are covered through Blue Cross. So you would have an 80% coverage through your Dal health insurance. The average cost of the medication is around $50 for each prescription, so the total cost to you would be around $10.
Okay. Is there anything else I can do to help relieve my symptoms during the outbreak that doesn't involve taking medications?
Some of the discomfort you may experience during outbreaks can be reduced by taking acetaminophen, which is Tylenol, taking warm baths with baking soda, to help relieve some of the itchiness you might be experiencing, or you can apply ice packs to the affected area. The most effective way to deal with outbreaks of herpes is to take your antiviral medication.
So if I take this acyclovir long enough, will I be cured from herpes?
Unfortunately, taking antiviral medications won't cure you of your herpes virus. They can only be used as a treatment. So let me explain a little bit more about how herpes works in your body. Herpes is a virus that is able to move into a latent stage where it's kind of sleeping in your body. So this is when you're still infected with the virus, but you're not experiencing any symptoms. But when the virus gets woken up by physical or psychological triggers such as stress, sunlight, exhaustion, or getting your period, it's going to inhibit your immune system's ability to control the virus's replication or the number of cells that are infected with the virus in your body, which leads you to become symptomatic.
So the virus would have been sleeping in me for a while, and one of these triggers would have woken it up?
Yes. And after this outbreak is over, the virus will go back to sleep, and you may not experience symptoms for weeks or even months.
Okay, so whenever I have an active infection, I should take the antiviral medications and refrain from sex so I don't pass it on to my partner. But I've never had sex with anyone who had an active infection. I've only had one partner in the last few months, and he didn't have any symptoms. Is it possible that I got herpes from a toilet seat?
So herpes can't actually be transferred through a toilet seat because the virus wouldn't be able to survive on the toilet seat and then infect you. Herpes is generally transmitted during sex and can be passed skin to skin in the genital or anal area, even if it looks normal. In fact, it is often transmitted in the absence of symptoms, so one of your previous partners could have passed the infection onto you when it was not in an active phase, although it's more likely to be passed when symptoms are present. Both strains of the herpes virus are transmitted in bodily fluids such as saliva, semen, or secretions from the vagina, or from sores that are infected with the virus when they come into contact with openings in the skin or mucous membrane, such as your mouth or nose.
That's why it's always important to use protection. Also, it's important to know that people infected with herpes virus are at increased risk for contracting HIV, because the blisters you're experiencing in your genitals give HIV an opening to pass through. So it's important for your health and for your partner's health to use protection during all forms of sexual activity.
Okay, so how should I tell my partner I have an infection without coming right out and saying I have herpes? Or is it illegal not to tell someone you have it, like with HIV?
No, you don't legally have to tell your partner you have herpes, but using protection is very important. And even if you don't have herpes, you don't know what your partner might have. But we definitely recommend talking and telling your previous partners that you do have herpes.
Okay, and I've never been with another girl who wanted to use protection. I feel like it's different with girls for some reason. I know it's not, but I don't even know where to get an oral dam or whatever it's called, or even how to use one.
You can find an oral dam at the Sexual Health Clinic on Quinpool Road. You can also get them at the Venus Envy store on Barrington Street.
What would I use if my partner had a latex allergy?
You actually have a few options. You can make an oral dam out of a latex-free condom, like a lifestyle skin condom. But to be most effective, you should use non-lubricated condoms without spermicide. Also, make sure you use a new oral dam each time you engage in sexual activity with your partner.
I can take a minute to show you how to use an oral dam and to make one out of a regular female or male condom. So why don't we take a minute to go through a demonstration of how to use an oral dam with your partner. Just to reiterate, it's important to use a dental dam whenever you are having oral sex, whether you experience symptoms of your herpes infection or not. So this is the dental dam. The first thing you need to do is take a look at the package expiration date on the back to make sure that it's still good to use. If the date of the package is expired, don't use it as it may have lost its effectiveness. So once you open the package, you're going to check the dam for any tears that might lead to the transmission of the virus. But make sure not to stretch the dam as it can cause tears. So before performing oral sex, place the dam over your partner's genitals. If you're using a lubricant, make sure it's silicone-based to prevent the breakdown of the dam that can be caused by petroleum jelly or other oil-based lubricants. Also, only use the dental dam once and do not flip it over. Dispose of the dam in the garbage.
So now I'm going to show you actually how you can turn a condom, like a male condom, into a dental dam. So first thing you want to do is make sure that the package is unexpired and that there's no puncture holes or anything in it. Again, like the oral dam, you want to make sure that it's non-lubricated and that there's not any spermicide on it. So let's open the package. And then what you can do is you basically cut the tip off of the condom this. And then you can kind of cut along it as well. So I'm just gonna. And then same with the dental dam. You would just place this over your partner's genitals, just kind of like the oral dam.
I can't imagine using condom because of the taste. Do oral dams have a taste like condoms?
So oral dams are usually latex-like condoms, but you can get them in different flavors. I'm sure some are better than others.
Another really cool tip is if you have plastic wrap that is non-microwavable, you can use that as well.
Plastic wrap? That sounds so much better than weird latex flavored things. And I can just buy it at the grocery store.
Yeah, just make sure it's non-microwavable because microwavable plastic wrap has tiny holes in it and fluids can sneak through that.
Wow, that's great. It's going to be a little awkward the first time I pull out a roll of plastic wrap when things are getting heated, but that's better than giving her herpes. I just don't know how I'm going to tell her though.
It might make things a little less awkward if you let her know beforehand that you prefer to practice safer sex to protect her and yourself.
Do you have a new partner?
Yeah, this is the first girl I've ever really liked and had a connection with. Every other girl that I've been with has just been like a fling, but I feel like this could be serious. We've just been taking things slow, and now I find this out.
Are you worried that this might affect your relationship, telling her about your diagnosis?
Yeah, exactly. I don't think she'd be upset. She's so kind and loving, and we haven't even been intimate yet. I just don't want to scare her.
She sounds like a really great girl, who'd be really understanding. Even though it might be uncomfortable for you to bring up this topic, it's really important for you to give your partner the ability to make an informed choice before you engage in any sexual activity together.
Yeah, we haven't been rushing things, so I guess we can just taking things slow, and once I wrap my head around this myself, then I can tell her.
That's great, Amelia.
Do you have any more questions about protection?
No, I don't. But how much longer is this outbreak going to last? It started about a week ago.
It'll likely last another week or two.
And some good news is your first outbreak is typically the worst, so the rest shouldn't be as bad as this one. They will probably only last about a week.
Whew. But what happens if I'm pregnant? I don't plan on it anytime soon, and so many people have herpes, and I've never heard about babies getting it. But I do really want to have kids one day.
So the chance of a mother passing genital herpes onto her baby is actually very low.
In babies, it's called neonatal herpes.
But I could pass it to my baby?
It's very unlikely.
Right now, your body is making antibodies to the virus. Antibodies remember the bad herpes virus and know how to get rid of it.
Once you eventually become pregnant, your body will pass the antibodies to your baby, and this will help protect your baby from getting it. But still let your doctor and midwife know that you have herpes.
Okay, that makes sense. This herpes thing really isn't that bad.
Yes. So let's go over everything we talked about today. Can you tell us what you've learned?
Sure. A lot of people have herpes, and a lot of people don't even know it. You can pass it on when you aren't showing symptoms, so that's why it's always important to use protection. And I need to ask all my labs partners to get tested to make sure that they know if they have it as well. You're more likely to pass it on when you are showing symptoms and you can't get it from a toilet seat. This outbreak will last another week or two, and my next outbreaks will last about a week. If I feel an outbreak coming on, I should get a prescription for antivirals that will make it less severe. And if I get outbreaks all the time, I can get a prescription to make it so I don't get it as often. Triggers that can bring on an outbreak are stress, being too tired, sunlight, and getting my period. For oral dams, you can also cut out condoms or use non-microwavable plastic wrap. Whenever I'm pregnant, I should tell my healthcare provider that I have herpes to make sure my baby doesn't get it during delivery if I am experiencing an active outbreak of symptoms. But my antibodies will help protect my baby from getting it too.
That's great, Amelia. Is there anything else that we can help you with today?
No, I think that's it. I learned a lot today.
Great. We'll come back to the clinic anytime if you have any questions.
Okay, thank you.
Thank you. Have a nice day.
You too.
Okay, go.
I'm just using my skills, draw my pen, really prepared me for this.
So before performing oral sex, place the dam over your partner's genitals, and you're good to go.
That's great, Amelia. Sounds like you. Yeah, I don't know what else to say. Okay.
It's because the pulling is out. I can't look at you. I don't know what's making me laugh. Okay. Oh no. I'll take a minute to show you how to make. Damn, what a female I know. Can we come back to that? Oral dams are usually latex like.
I can't.
So basically we're coming through Blue Cross. So
And your genitals.
I'm acting.
So both strands of herpes are transmitted in the mucous membrane